Shall I start again? Yeah. I'll switch my brain on. So welcome to this meeting of the Adult Health and Social Care Policy Committee. My name is Councillor Artenzio. I chair this committee. I don't think we have anybody from the public today, but people might be watching. The meeting today is open to the public, and there are no items that contain exempt information. The meeting will be webcast, and the recording will also be available for people to use later through the Council's website. It is also possible that Sheffield Light TV will record and rebroadcast the meeting. Can I please request the mobile phones and any other such equipment are switched to silent mode or switched off, as to not disturb the meeting itself. There are no fire tests planned for today. If there is an emergency, please take instructions from the Town Hall staff, and the assembly point is Tudor Square. I will now ask each committee member to introduce themselves, and I'll start as usual on my left.
Thank you. Good morning. I'm Councillor Laura McLean, and I'm Group Spokesperson for this committee.
Good morning. I'm Councillor John Wright. I'm a substitute member of this committee.
Morning, Councillor Ruth Nelson, member of the committee.
Good morning, Councillor Mick Rooney, representing Woodhouse Ward.
Good morning, I'm Councillor Christine Gilligan-Kubo, and I'm from Hillsborough Ward.
Councillor Will Sapwell, Stannington Ward.
I'm Councillor Steve Ayres, Graves Park Ward.
Good morning, Councillor Sophie Crosthorne for Beechif and Greenhill, and Deputy Chair of the Policy Committee.
Thank you. I will ask officers that are at the top table to introduce themselves now.
Sherry Grant, Assistant Director for Legal.
I will do Fiona first.
Fiona Martinez, Principal Democratic Services Officer.
I'm Matt Bowser, the Interim Strategic Director of Adult Social Care and Wellbeing, and I clearly don't know what I'm doing with microphones.
As long as you know what you're doing with social care, we don't mind. And we've got Rebecca supporting us on the tech. So we have received apologies for today from Councillor Jane Dunn, and Councillor Wright is here to substitute on our behalf. As said previously, item 2, exclusion of press and public. There are no items on the agenda that require us to bar people from the room. Item 3, declarations of interest. Do any members wish to declare an interest on any items on the agenda? No? Brilliant. And item 4, these are the minutes of last meeting. They are on page 11 of the pack. And you have a copy for me to sign, haven't you?
I do, yeah.
So I will go through each page just to check the accuracy and whether there are any matters arising. Page 11, page 12, page 13, page 14, page 15, 16, 17, and 18. Are members happy for me to sign the minutes as an accurate record of last meeting? Brilliant, thank you. And we move on to item 5, which is public petition questions and statements. We have not received any this month. Item 6 is members' questions, none received by the deadline or after. So we can move on to item 7, which is the work programme, which is on page 21 of the pack. Fiona, is there anything we need to know about this? I know that there are 2 slight changes which I'll mention.
Yes, there are the 2 slight changes. As always, I encourage members to suggest any additions or amendments. Aside from that, I would like to draw members' attention to a referral that we've had from Full Council on dying in poverty. That's on page 23. That's asked that the Adult Health and Social Care Policy Committee consider adding to its work programme a review of the support that Sheffield City Council provides to those with a terminal illness. So as this is a referral from Full Council, it's something I wanted to raise with you all. Thank you.
Are members happy to add that to our work programme? And are people happy also to discuss this in a briefing when it's appropriate? Because obviously we need to confer with officers in terms of timings to look into that properly. Is that okay? So we'll add it to the work programme, time to be confirmed, depending on advice from officers. Is that okay? So the two changes that I have are, there is an item on the December agenda which we are suggesting to move to January, and it's just a timings. It's the carers and we have proposed to change the timing in relation to the carers item that was scheduled for December and move it to January. The slight delay will enable the committee to have fuller details on the carers offers and membership. Members are welcome to direct any queries to the director or Mary Gardiner. Are members happy to move that? We've got to accept that the work plan is a draft and it's a working document. And the other change is just a clarification. Again, it's an item that is in December. I'm just trying to find it on here. So it's the...
I'm not sure it was on the account, so I think it wasn't.
Okay, it's something that we may get in December then. We have launched a consultation on changes to the fare charging policy last week on the 13th of October, and we may have a proposal for change to be brought to the committee in December on the back of that, but we need to get into the consultation before being in a position to formally add to the work forward plan. So it might be added for December, or it might be added later on, okay, following the consultation. Are members happy with that, with possibly an extra item in December, but we move in one item, so there will be the same, there should be the same number of items. Is that okay? Brilliant. So are members happy to approve the work programme with the changes proposed? Brilliant. Yeah.
I think we also need to add the amendment that we had in relation to budget for December as well, because that's when we committed to come back to respond to the item that was raised in previous committee.
So that is on the agenda, but it is currently without a date, so we do need to put a date in for that. So it's included in the items for which the committee have agreed to add to an agenda, but for which no date is set. So that's on page 29 under finance item as requested at committee 1709.
Yeah.
Do you
need to set a date? Yeah.
Are you saying that we can add it for December, that we're going to be ready with that in December? Brilliant. Shall we add that in December then? Brilliant. Thank you. So we're happy to approve the work programme with the changes proposed. Fantastic. So we are on to item 8, which is the DAS overview. So I assume that the DAS is going to present this.
Yes, indeed. Thank you, Chair. So, as committee will recall, the purpose of this report is to provide an overview of progress in the Directorate, and rather than read through it verbatim, I'm going to draw your attention to the key content. As per previous committee, we will append the full data performance dashboard. What we've done in the body of the report is pick out exceptional performance, either positively or negatively, and I'll go through that on a line-by-line basis. So the data referred to is the August performance dashboard. In terms of areas of improvement and successes, we've seen an increase in the number of safeguarding inquiries per 100,000 adults on a year-on-year basis. we've seen a continued increase in the percentage of those safeguarding contacts that are screened within 1 working day. We've continued to maintain high performance on the proportion of carers who receive self-directed support. We've got some very positive news in the care marketplace. So the percentage of adult social care providers rated good or outstanding by the CQC, so this is domiciliary care, residential homes and nursing homes, is up to 89%. The target that we set for the year was 85%. This performance is better than most of the core cities in England, so I'd like to publicly congratulate all of those registered care providers who've achieved that level of standard in their service provision and that it reflects so positively on the range of choice available in the city. In terms of annual reviews, we are making very incremental progress on those reviews. We've previously discussed the work that needs to be done, particularly on adult mental health here. Overall, we're at 55% of completion of annual reviews within 12 months. I think we're up to near 98% within 2 years, but we are expected to undertake those reviews within 12 months, so there will be continued focus on that target, including the work on the review strategy that's cited in the report. In terms of areas of concern with performance, we still have 1,305 people waiting for DOLS applications to be approved, deprivation of liberty safeguards. The overall number of referrals or applications we've received has now increased to 2,937, so we're not at this point in time making the headway that we need to in reducing that wait list. I know that there is a government consultation on DOLS, and I'm expecting some further questions about that, so I'll get into more detail when I receive those today. In terms of home care, the waiting list has increased from 10 to 13 people, but those of you who've been on the committee in excess of 12 months will know that that represents huge progress from where we were this time 12 months ago. That is pretty much as close to real time as we can get. It's reflected in our Pathway 1 discharges from hospital. We have seen a slight increase from 50 to 57 in terms of people waiting for occupational therapy assessment. Many of our OTs are now involved in the review programmes that we've kicked off in relation to budget recovery. We are hoping to get back to the positive position that we're in, but again, if you look at that performance over a 12 or a 24-month basis, it's significant improvement and a relatively strong position. Moving away from performance onto the strategy delivery plan, a review of that plan is due, which will involve people with care and support needs, carers, staff, wider corporate colleagues and partners. And when received, and I'll come on to talk to where we've got on to CQC later, will clearly need to reflect recommendations from our inspection report in that delivery plan. On to the sensory strategy, the rollout is now taking place. British Sign Language drop-ins are taking place in extra care schemes. Work continues with Department of Work and Pensions to provide BSL courses for immigrants who are new to the UK. The Sensory Partnership Board met in July and agreed training and development, transitions, pathways to work green paper and communications as its work streams. So the strategy that you approved back in March is now very much coming to life. Onto the dementia strategy, we've had 24 new organisations sign up, doing some work on internships with about 100 hours worth of contributions at the University of Sheffield. Training has been rolled out to staff at Simca, and now their vehicles are branded to raise dementia awareness. And we've done specific work with both the Somali and the Chinese community where prevalence of dementia is underrepresented to make sure that we are providing the appropriate training, working alongside those communities and understanding the needs of those communities to continue to improve there. We are now seeing over 100 more referrals this time this year compared to last to memory services, which obviously helps improve early diagnosis and therefore gets people the support that they need. So the dementia strategy is also in implementation space now. Onto the S2A pathway, new providers are being onboarded. There are some operational pressures in relation to the completion of decision support tools and relatively tight bed capacity, which we will focus on in a bit more detail when we get onto the winter plan later on the agenda. But I'm pleased to report to committee that the bed tracking system that's been long promised is now in place and operational. Finally, since we last met as a committee, a significant amount of time and attention has been devoted to the adult social care transformation plan that will be before you today. Those plans are an excellent opportunity, not just for us to strengthen our prevention model as a council, but also to drive the kind of performance improvement that I've described earlier in this report. So I really do encourage you to ask all the questions that you wish. I will stop there. I'm happy to take any questions about the detail of the report or the appendices, Chair. Thank you.
Councillor Sapwell.
You may cover this in a later item, but on the doles, we're obviously going into winter, expecting more hospital admissions. Is there any part of the plan, and it might be in the next item, I appreciate, whereby we're looking at expanding capacity or addressing the issue of the backlog of doles going into winter for the increased demand from acute hospitals? Thank you.
Thank you. There is a doles improvement plan. I'm not aware that doles are a particular issue in relation to our discharge from hospital performance. I will, however, mine that data and get a clear position so we can identify the proportion that are. What we have done is implement a prioritisation list that's got clear criteria to effectively risk rate the cases. So if the consequence of the deprivation of liberty is significant, that person automatically gets prioritised in the list, and obviously the corresponding impact is that lower priority cases then wait longer. So I will share both that performance data and the criteria so you get an idea of how the team are prioritising the work that they're dealing with.
Councillor McLean.
Thank you. Thanks for your report, Matt. My question's also about the doles, and as you mentioned, the government this week have announced that they're going to do a consultation on liberty protection safeguards, and they're looking to bring that in. And I know that remove what they're planning, that would remove the 12 months of authorisation to make it last for 3 years. I just wondered what your thoughts are on the proposals and whether you think that will help us in Sheffield. And obviously we've discussed at committee over the last few months that this is very much a national issue that councils across the country are struggling with, but if there is the opportunity, will our council feed into that consultation and provide some feedback? Thank you.
Thank you. I completely welcome the consultation. A growing proportion of our waitlist is renewals. The vast majority of those people are receiving formal care and support and are safe. The process is complicated by the need to involve medics in terms of sign-off of the authorisations. So I think there is plenty of scope to streamline that process whilst also ensuring that we do what is in the spirit of legislation and provide a clear account where liberty is restricted. I think the move to 3 years, if pushed through, is very sensible. But I think ultimately we do need to be able to give a clear account of how we manage that risk. And in terms of the question about consultation, I will escalate that with the Safeguarding Board and look for a partnership-wide response to the consultation. So we've got one position as a city. Thank you.
That's a sensible move, I think. Any other question? Oh, sorry, Councillor Milson. Yes, I did have you down.
Thank you, Chair. Thanks. I wanted to just ask a bit about the S28 pathway and discharge, and just because there's not a lot of room for detail in your report here. So discharge with the increase in beds occupied by those who are discharge ready creeping up again. Just wondered if you got a bit more comment about that, and really where, if there are any patterns to where the hold-up lies. Does it sit with us? Does it sit within the hospitals? And I wanted to ask a specific question about S28 and the process for determining that someone should use that pathway on discharge, because I have learned of, this is one specific case, but it leads me to think, what if there are others? That's quite scary. One gentleman who was due to be discharged home but had been hospitalised and not for the first time because of not coping at home with dementia. And he was just going to be discharged home again. He'd been on that admission, been found lying face down in his kitchen for goodness knows how long, and there was evidence he'd been eating raw food. And someone like that shouldn't be just discharged home. So I'm wondering where the hold-up lies for people who are waiting in a bed, where there might be a gap in accountability in the discharge conversation that might lead to something like that happening.
I think to answer the question with the level of detail that you would like is probably worth a specific briefing that I'd open out to the entire committee in terms of really getting into delays right the way across the system. Richard may well want to comment on S2A specifically further. In terms of the case you referred to, I'm not aware of that particular case, nor would I comment on an individual case in committee, but that does sound rather concerning on the basis of all the key factors that would need to be in place for safe discharge. So I'll happily have a conversation with you offline about that particular case if you'd like me to look into it. Richard, you won't have a microphone. Did you want to just come up and... I can talk loudly if that's okay. People online won't hear you.
Well, okay, so in terms of the S2A pathway, so we're working with STH to develop what's called the Transfer of Care Hub. That's currently rolled out to 18 wards, and that's a multidisciplinary hub that makes an assessment. Oh, it's lost me. That makes an assessment about people's appropriate pathway. It isn't currently rolled out to all of the hospital wards, but their aim is to have it rolled out by December to all wards. The S2A pathway is currently under review, so there will be a paper going to the Joint Efficiencies Group soon, looking at how we prepare S2A going into the winter months, with a view that we need to review the whole pathway post-winter in terms of optimising, ensuring that we're flexing across pathway 1 to 3 appropriately to ensure that people are going into the right pathway and getting the right support, with a view that we should be able to get more people to the place that they call home, whether that be their own home or whether that be a suitable residential placement. So I think what we're aiming for is stabilisation over the winter period with the S2A, so somewhere to assess, sorry, apologies people, somewhere to assess pathway, which is pathway 3, and then we will look to review the functionality of somewhere to assess post-winter to make sure that it's an optimal pathway going forward. Hope that helps, Ruth.
Any more questions? I have a question actually, and I've been thinking about it. It's been going around in my head for a few weeks, and I was wondering, you know, in terms of the sensory strategy and the dementia strategy, particularly in terms of the sensory strategy, from, you know, experience with comments that I've had from people, I would be interested in looking at how, when we have any report about any of the services, how people with sensory impairment are being thought about in the context of that particular item. Because one of the comments that I often get from people with a sensory impairment is that they feel that when services are created, they are an afterthought rather than things being embedded in so that they are catered for. And I wonder whether we can have something, I don't know if we could have a different kind of EDI, you know, for each item where we think about people with sensory impairment, people with dementia, people with neurodiversity at the very beginning, and the reports have some information on that particular cohort so that we know that services are being thought of and changes are being thought of with those people in mind. More kind of, I'm sure that they are, I'm not saying that they're not, but it would be good to track and for us to be reassured that actually that is happening.
I I think it might be prudent for me to have a look at our equality impact methodology and see how that's reflected in consideration around protected characteristics and disability specifically. And obviously, equality impact is a factor in each one of the reports that comes through, but if there's more emphasis that's required, I'll speak to the appropriate officers and see what we can do.
Thank you. Okay, so we have some recommendations on page 32 of the report. There are 4. So it is recommended that Adult Health and Social Care Policy Committee knows progress in delivering upon adult health strategy, living the life you want to live. And number 2, notes the performance update and area of prioritization and focus. Notes the strategy delivery update and achievement for this period. And notes the progress of our preparation for CQC and recent site visit. And obviously we've got the report on item 11 to also consider. Are members happy to approve those recommendations? That's unanimous. Thank you very much. And we go on to item 9, which is the Equality, Diversity, Inclusion and Social Justice Delivery Plan 2025-26. And John is presenting this. Thanks, John.
Hi everyone, John Chamberlain. I'm a Workforce Development Manager in Adults Care and Wellbeing Service, and I'm here to present the item around the update to the Equality, Diversity, Inclusion and Social Justice Delivery Plan. So thank you for having me. So this, the paper and the appendices that have been included today in the pack is, as I mentioned, an update to the Equality, Diversity, Inclusion and Social Justice Delivery Plan. That was a plan that was first launched back in December 2023 at this committee, and this is the latest update to the delivery plan. And the delivery plan is essentially outlines how, as a directorate, we're meeting some of our statutory duties and our public sector equality duty as well, so including things like Equality Act, Mental Capacity Act, Care Act and other statutory obligations that we have in regards to that. The plan itself is framed, when we were developing it, was developed around best practice from local government association and used the diverse by design principles, which are cited as best practice. And the plan itself is framed around 5 priorities. So 1 is knowing our workforce and communities, 2 is partnership and accountability, 3 is practice, learning and development, 4 is active in independent living, and 5 is creating a safe and inclusive work environment. And the report that we've included summarises key highlights, but the updated delivery plan is outlined within appendices 1 and breaks that down in quite a lot of detail in terms of the specific actions that we're taking under each of those priorities, which is obviously within there. For the purposes of this update, I'll obviously not give a kind of full breakdown individually of each of those areas, but just wanted to really highlight some of the key kind of recommendations and some of the progress that we've made in regards to this area, which is included in the report that you've got. So what I'll do is I'll briefly just run through some of the key areas in this and then some of the recommendations. So the first area we wanted to really highlight was some of the progress that we've made in implementing the Skills for Care Workforce Race Equality Standard within Sheffield City Council. It's noted that activity has been completed for the first year of delivery, and that includes a data report and then an action plan, which sits underneath the submission from the council for the first year of delivery. It's also been noted that we've committed to undertake the RES again for 25-26, and that we're going to be doing a joint submission with our Children's and Young People's Services Directorate as well, so doing a joint approach for the council moving forward. It's noted as well that this approach aligns well with the priorities around race equality for the council, and we're looking to further develop that work in partnership with the Sheffield Race Equality Partnership as well. So really trying to bring a joined up approach with that, and there's some of the detail in terms of some of the findings and some of the progress that we're making in regards to that underneath that. But I think that's some really good work that we're undertaking in regards to that. In the paper as well, we also provide an update in regards to some of the work we're undertaking around supporting ethical international recruitment, and in particular some of the legislative changes that have likely to have a significant impact to the care sector as well. So and those changes were made by central government as well. There's also an update in regards to some of the support activities that we're undertaking with the Sheffield care sector market, and also the development of a Sheffield City Council modern slavery statement that's been developed corporately for the council as well. So that has just gone through committee to be signed off as well, as my understanding. There's also an update in regards to some of the work we're doing in relation to community engagement, and in particular the extension of the partnership work with SACMA, focusing around the Black, African and Caribbean communities, but also some of the additional work that we're planning to undertake, and we are undertaking in partnership with Sheffield University and other partners in regards to that. There's also an update, and we've included a section in the delivery plan which is in regards to our information, advice and guidance offer from the council as well. So currently that's being delivered through Sheffield Directory, but there's also some activity that we're taking in regards to that to make sure that we've got an accessible and inclusive AIG offer for the sector as well moving forward. We also, there's also some highlights that in regards to our equalities training offer. It's noted that we've developed a programme of training in regards to anti-racist practice, which is our equity accomplice training, and that's currently being delivered to senior managers and will be rolled out further to other team managers moving forward. And there's also other notable updates in regards to the development of our equality and disability related training, including Oliver McGowan and disability confidence training. Some of the other key priorities that we've identified for delivery moving forward is in regards to reviewing practice and support for staff who face discrimination or harassment, and that's some of the findings specifically from the RES that's come out, and trying to work on some of our practice in regards to that. We've also identified some of the practice around the completion of equality impact assessments, which so the chair's just raised as an issue. So it is noticed that, it's noted, in adults we've got 100% completion for equality impact assessments for any of the decisions we're making, but I think it's been flagged in terms of some of the quality of the EIAs, but it's been and some of the support offer that's needed in regards to that is something that we've suggested that we'll try and support managers with moving forward. One of the other key areas that we've noted as well is in regards to quality monitoring information. So this is of customers or people that we support and also our staff as well, and trying to improve the practice around that and trying to improve the reporting and recording of our quality monitoring information, because that will support us in terms of analysis and trends in regards to qualities moving forward. And then moving forward as well, which is developing some of the practice and support in regards to the wider care sector. So in particular looking at the practice in relation to things like culturally appropriate care, but then also improving our kind of work in the care sector around training and other things in that sort of themes. Lastly, just to note that there was a recommendation in the paper made, which is to change the cycle of assurance from a 6-monthly basis to an annual basis moving forward, and that's recommended that aligns with the submission of the Skills for Care workforce data set, which is usually submitted around October. So ideally the next update would be sometime December or January onwards from in 2026 or 2027. So that's the recommendation for the paper moving forward. I'll stop there and take any questions, if that's okay.
Councillor Harris.
Yeah, it was interesting, the section of the report that talks about the projects in partnership with ADA supporting displaced overseas workers. I just wondered whether you could say a bit more about that. What other local, are we working with other local authorities within South Yorkshire on that? And, you know, how are we, what activity is actually going on in order to you know, find placements for those displaced workers? And the other question is, it says here that the DHSC has extended it until July 2026. What assurance have we got that it will run beyond July 2026. Thanks.
That's great. Thank you very much. So it's particularly in terms of the, so that's the International Recruitment Project, which is funded by central government and is being led by ADAS. The support is available across Yorkshire and Humber. They use a hub and spoke model, so there's a regional lead in each of the areas across Yorkshire and Humber, with then delivery taking place at local level. So Sheffield City Council have recently taken over the project management of the region for South Yorkshire, actually. So it's one of our colleagues in Children and Young People Services, actually, that's taken over some of the work in that regard. So and that took place early this year. So we are now managing the response across the region, and there's also a team now that's working individually with workers within Sheffield at the moment. So the latest stats, we're working with approximately, there's around about 300 people that's on our caseload at the moment within Sheffield. Regionally, it's noted there's could be approximately around 6,000 people that have been impacted by this. So it's obviously quite a high demand regionally in terms of the people that are in that work. So I think it's a really important piece of work actually that's working in regards to that. It's noted that we're working in partnership with the Pathways to Work programme and our Opportunity Sheffield colleagues as well to try and join up the approach to supporting people seeking employment, particularly the displaced workers seeking employment. And there's the specific activity that's working with care providers to try and generate employment outcomes and try to get people into work. And I can provide further information, outcome information, if that would be appreciated, in terms of how many people we've supported into employment and what the current caseload is for Sheffield, that kind of thing. So I can certainly do that moving forward. In terms of the second question, which is about the sustainability of the project, currently, the funding, as outlined in the paper, runs until July 2026. So we don't have any steer so far in terms of whether that funding will be continued from central government. So we'll have to wait for that. One of the things we are looking to do as part of this approach, and it's part of the reason why we are working in partnership with other organisations like Pathways to Work and the Employment Support Services, try and build in some of the support work as part of our business as usual practice in this space as well, because we know it is going to be an ongoing area that we're going to need support, really. So we are trying to build that into our business as usual approach and try and work with providers as well to make sure that they have got the support they need to be able to to support people that are displaced in this space as well. But as I've said, there's not ongoing funding in that space, so we do need to, it's something we need to consider as part of the next phase of that approach and the delivery of that project. So, okay.
Councillor McAlee.
Thank you, and thank you for this report. There's loads of good stuff in it, and there's lots of things we could talk about. But I just wanted to ask about the section on the workforce race equality standard, and there's reference to that our diversity as a council decreases as grades increase, as lower representation at senior grades. And the next page, some of the suggested next steps are to sort of explore career progression routes for those who wish to develop further. And I just wondered if you've got a bit more detail about what that might look like. Thank you.
Yeah, thank you. Yeah, absolutely. I think it's certainly one of the areas that's been flagged, not just in adult services, but I think council-wide as well. It was noted in the annual report for Sheffield City Council that was the diversity of our senior leadership was not as was representative of the people that we support as we would possibly want to do. In regards to that, I think there's what we're planning to do is work with our corporate colleagues to look at how we can have more join-up approach around career progression and representation around that specific item. There's also some actions that we've noted as well as that further investigation needed in terms of some of the recruitment practices that we've got in terms of making sure that we've got good practice. I would say that the council's been lauded in terms of the progression we've made and the developments we've made in regards to our recruitment and selection processes, but I think it's an ongoing piece of work. I think at this moment, I think it's obviously the findings has shown that it's an area that we need to do some further investigation with, but I think as I say, because of it's highlighted as a council-wide approach, I think we need to develop that further with our colleagues corporately as well, see how we can develop that moving forward.
Any further questions? questions. I just wanted to say something on the same point on the diversity of senior managers, because that is something that has been, I have personally raised for quite a few years. When I was on auditing standards in particular, we were looking at the annual report about, the senior management, how many people and over a certain amount that we have to have that report. And I remember myself and Councillor Mohammed Maroof, we always asked what about ethnicity, and I'm so pleased that we are finally looking at that, and I know that corporately we are working really hard. I think it's how we embed the progression of staff, particularly internally, where they can kind of smash this glass ceiling at grade 6, and because that is something that staff continue to report, is how there are barriers for people from different, from minoritized community to go above grade 6. So it's really fantastic. And also the other thing that I want to stress is how, we are leading on this, and how, we're making representation to aid us in terms of the work that we're doing on EDI, and so that's really good, and it's really good progress. If I consider like the journey we've been on in terms of this kind of thinking how now it fits in corporately, so it's really great. So thank you very much for the report. Are there any further comments? Okay, so we have 2 recommendations there on page 60 of the report. So the first recommendation is to endorse the progress made with the Adult Care and Wellbeing, Equality, Diversity, Inclusion and Social Justice Delivery Plan. And number 2 is to request that the Strategic Director of Adult Care and Wellbeing continue to provide the committee with updates and progress against the delivery plan. It is recommended that this is amended to an annual basis. We've had it every 6 months in the last year or so, haven't we? Including updates made based on ongoing learning. Are members happy to approve those recommendations? Thank you, that's unanimous. And we are moving on to item 10. Thanks, John. Which is on page 99 of the report, and is the Adult Social Care Winter Position Statement 2025-26, and Richard is presenting this item. Thanks, Richard.
Good morning, everybody. I'm Richard Groves, Director of Operations for Adult Care and Wellbeing, and I'm going to be presenting the Adult Social Care Winter Position Statement. So each year, Adult Social Care, along with our system partners, work towards a joint plan around winter preparedness. The plan this year was prepared by the Urgent Emergency Care Board, and Adult Social Care contributed to that system plan. This plan sets out our position in adult social care and provides a framework identifying where we might see problem areas and what actions we need to take to resolve those problem areas. And the full framework is attached in appendices to the report. So in terms of setting the scene, so included some information in here around our current position. So there's information around our current staffing capacity and where we have capacity, particularly in our Home First and short-term intervention team who support our hospital discharge function. So just to note that over the last year, we've seen an average of 78.7% workforce capacity in our Home First team, and that's been fairly consistent throughout the year. So that is fairly, that's putting us in a fairly stable position going into winter, and we can expect, hopefully, to see that maintained. We did see slight dips in December, along with winter pressures, and we did see a seasonal dip in summertime, which also aligns with when we expect people to be taking the summer holidays off. And that is echoed by what we see around discharge planning as well with our system partners. Then it goes on in, there's a second table and figure 2 on page 102 that outlines the demand that we're seeing in the short-term intervention team, and you will see that there is a trend in the number of referrals increasing, but actually the number of people that take up the service remains the same, and that highlights a current issue whereby we're seeing lots of failures where we're getting referrals that don't lead to an outcome of a placement in the short-term intervention team. So we've currently got our workers actually based within the discharge lounges and working with discharge coordinators to try and drive that pressure down. So that's one of the actions we've taken to mitigate that current issue. In terms of discharge, again, we've seen a relatively stable situation from STH across the year, so averaging 260 to 290 daily discharges across all of the pathways. And again, we saw slight seasonal variation in January due to winter pressures, and then again in the summertime, which again is attributed to the school holidays. So this proposal looks at existing and planned winter preparedness activities, and it puts it into a single consistent framework. The plan focuses on infection control, collaboration, workforce and carers, and system resilience. And then you will also note that there's particular attention being made to growing pressures associated with mental health discharge. So in terms of the first theme, prevention and controlling the spread of infection, just to note some of the actions that we're taking. Unsurprisingly, there is a seasonal vaccination campaign being taken by the City Council, and what we will be doing is looking to leverage internal comms to ensure that staff take that up. And in terms of infection prevention and control, it is very much about existing relationships and leveraging the current working routes that we have, for example, with our provider forums, with newsletters, just to accelerate people's understanding around the importance of infection control. In terms of the second theme, we are looking and currently in a workforce change to expand our Home First offer. So we were looking to provide additional discharge to assess slots and additional home care capacity through that reablement offer. We're also looking at the formalisation of a proportionate assessment, which can be used as an option. So it's something that was done informally last year as a reaction to system pressures. We've formalised it to put it in place as an option if we should need to expedite discharge at a faster rate. And the system has already called on us for expectations around weekly escalation meetings. And the expectation is that they could increase up to daily should the need arise if we encounter system pressures. And then in theme 3, supporting people who receive social care. So just to note that we have our Home First as a provider of last resort. So if we see any challenges within the market, we will use our Home First offer to step into those gaps. We have Sheffield Carer Centre, who is offering advice on fuel poverty, hospital discharge support and access to benefits. Very interestingly, yesterday SLT attended a discussion with somebody from our property sector around damp and mould. So leveraging our existing relationships, our face-to-face contact to just escalate that, and there's other factors that can come into that, not featured in the report around cold homes that they can support with and that. So really using our contacts to understand what the opportunities are to support people during the winter months. Then in terms of theme 4, as already discussed, the S2A framework is being reviewed, and we're looking at that to stabilise over the winter period in terms of improving our bed utilisation and ensuring operational readiness over the winter period. We've also got a new brokerage model for our care home placements for older people. This is really a wonderful opportunity which will enable our social work assessors to prioritise their assessments, while the brokerage function supports with the negotiation with care homes. And then, as already said on that theme, the expansion of our current reablement model. So I would like officers to pay particular attention to the mental health discharge escalation protocols. We saw quite difficult challenges around the mental health pathway last winter, so we've taken action with the Mental Health Trust to get ahead of some of those. So we've already started weekly mental health discharge escalation meetings chaired by the ICB. Those are multidisciplinary meetings that happened outside of the existing discharge meetings to provide challenge to any of the decision making and expedite discharge. There are also now bi-weekly leadership meetings that are supported by the chair of the ICB, by Matt the DAS, and by the Ops Director from the Mental Health Trust. So they are providing that challenge and assurance around that planning. We've also agreed use of discharge grant to create additional capacity around our mental health social work discharge team as we go into the winter months. And we also have a new test for change coming online in the winter period, where we're extending our short-term intervention team offer to flex into mental health to provide discharge support for those people that are going home. So they'll be able to do in-reach into the wards, and then they will support somebody to go back into their own home. And then last but not least on the themes is around data gaps and monitoring. So just to note that as the council is currently in a recruitment freeze, this can contradict what I'm saying here in terms of building the right capacity. But what we're working with our officers to do is ensure that they build in the right quantitative data so that any recruitment panels can make informed decisions around demand and capacity to ensure flow, particularly around the mental health discharge pathway. And then there is also an ongoing review of data with our Mental Health Trust to try and achieve one version of the truth. And then finally, in terms of the report, just to note in terms of financial considerations, this is already forecasted, so we're not expecting any additional contributions at this point. The money that we're expecting to be supporting our discharge over the winter period is what's already forecasted. In terms of legal responsibilities, this is our Care Act responsibilities, so there's no considerations outside of that. And that is me done.
So I have Councillor Milson and Councillor McLean. Can I take you two and then I'll come back?
Okay, thanks. Thank you for all of that. Again, there's an awful lot that could be unpacked a lot more, but that would be exciting but not appropriate now. Just wondered about the infection control, just a little bit more detail about what that looks like and what's considered necessary during winter that isn't considered necessary the rest of the year. I'm always quite intrigued by this because infection control should be surely a year-round thing. So what gets escalated during winter and why in winter, and are these measures that should be there all the time, and what they look like really.
So
and sorry, just the other thing as well is about mental health discharge. Just is it the case that a mental health inpatient who is for whatever reason on a general ward rather than in an acute mental health bed does not have recourse to the step-down facility? And if that is the case, why is it so? If it could hinder someone's progress to reablement.
Richard, I'm going to take Councillor McLean and then you can respond to both. Is that
okay?
okay?
Yeah.
Thank you for this report. I have two questions. One about the sickness rates you mentioned on page 101 in the Home First and STIC team, and sort of plans to sort of make sure that services still run smoothly in spite of that. But I just wondered, has there been work going on to look at why that might be and if there's things that can be done to sort of help with that? And then my other question was about the Home First Community Mental Health team, and it's just really great to hear that that's ready to go in November. It sounds really positive. And I guess I just wondered, just out of interest, for say someone who is clinically well but has mental health problems and needs to be discharged, how is this year going to look different to them than if they were ill last year? What would that look like on the ground in terms of their experience? And also with this being a new initiative that we're doing this year, how is it going to be reviewed, and will there be like capacity to tweak it as the winter goes on if there needs to be sort of changes and modifications? Thank you.
Okay. So in terms of infection prevention control, the standard doesn't change. So it continues to be monitored by our ICB colleagues and by public health, and providers have to respond to those situations. So the standard doesn't change, the profile does though. So it is about assurance and escalation in terms of seasonal respiratory illness. So we do see increased respiratory illness over the winter period due to, you know, the cold, people turning their heating on, and a number of other factors that contribute to it. So it is just about raising the bar on the understanding as people go into it, because we see that heightened pressure, particularly around hospital admission. In terms of the step down from the non-acute, so the non-mental health trust beds, this is a test for change. So at the moment, our focus is around the mental health discharge pressure in the Mental Health Trust. That isn't to say that people couldn't access this as we roll out that test for change for the Pathway 1 discharges or the Pathway 0 discharges from STH. But it isn't our focus at the moment because it's to respond to a particular pressure in that system. In terms of the sickness rate for Home First, that's been fairly consistent over the last year as well. It is unsurprising that they carry the highest sickness rate given that they are a provider service and that they are coming into contact with people who are unwell. And so it isn't a concern as such, Laura, but if Kelly was here, she would be flying the flag for the work they are doing around performance and assurance to manage through attendance management processes and support to ensure that they improve on that sickness period. So there's active work being done with the team and through the workforce change that they're delivering to improve on that. And then the last thing in terms of what would it look like differently. So the Home First model, to confuse everybody, so we are doing, we've got a Home First team, not to be confused with the transformation programme that the Trust have called the Home First Transformation Programme. So there is a full programme of work that's reviewing the whole of the mental health pathway in terms of the community in-reach, the community outreach, and then indeed our mental health enablement work fits into that. The difference is that sometimes, unfortunately, due to provider availability, people that are ready to go home are sat in a hospital bed waiting for the provider to pick them up, and that's not a good outcome for the individual. So just as our short-term intervention team are working with STH bridges that gap, but also looks at how we can support people to become more independent, that will be the same offer, although with a mental health focus. So it will look quite different because they will need specific mental health training, there'll be different outcomes to be achieved because it will be less about enabling somebody in an environment relying on, you know, how a person gets up, how a person washes himself, and more about how a person engages with their environment, how they engage with the local community, for example.
Great, thank you.
Thank you. I'm going to take Councillor Sapwell and Councillor Gilligan-Kubo and then ask Richard.
Thank you for the report. My question follows on quite nicely from the discussion we've just had about infection control. So are our staff and the staff of our contractors who come into contact with patients and service users, are they being offered flu vaccines? Are they being offered COVID vaccines? And if not, is that a preventative measure that we could look into providing if they're not being provided? And to follow on from that, are those staff being encouraged to isolate if they're suffering from viral symptoms, or are they being pressured into working? Thank you.
So in terms of...
Richard,
sorry.
do you mind if I take Councillor?
Thank you. I need it a bit nearer. My question is almost the same as Will's. It's about infection and the spread of infection. And I was just curious, are we recording the amount of staff uptake of vaccinations on an annual basis? And is there a degree of vaccine hesitancy? And how are we addressing that? So I think we're all interested in infection control.
Okay, so in terms of in terms of the vaccination, so we have a vaccination offer that's been shared already via the Adults newsletter that's gone out. It does encourage those that can access the vaccination for free to do so, but equally that we can offer support in that. We will continue with that campaign through our newsletter. We will encourage external providers to do the same in terms of what they might offer in their spaces. I'm not aware of the COVID vaccine being offered in the same way, although the COVID vaccine is offered via the NHS to individuals who are at risk of the vaccination of coronavirus. In terms of pressure, sorry, mate.
Sorry, Councillor Rooney, can you just wait your turn?
So in terms of pressure, I mean, the standard is that somebody who, having had a respiratory or a contagious illness, should not return to work until 48 hours of being clear. So that's a pretty standard infection control standard. There is leverage in that, obviously, for frontline workers, that's pretty strict. For other workers, particularly our assessment staff, they may be able to work from home, and that's an option available to them. And that's a standard set by public health and our NHS partners. That should be pretty standard within both the council and all care providers. And in terms of vaccine uptake, I'm not aware that we do monitor it. It's not something that adult social care is. We don't manage the process by which people access the vaccine, but I can take that away for consideration and ask colleagues that are responsible for that what the take-up on that is.
Thank you. I have Councillor Rooney, Councillor Ayres.
Thank you very much, Chair. I was just trying to point out that you have to be over 75 to qualify for the NHS COVID, because I found that out a couple of days ago when I was trying to get it and they wouldn't let me. My question is actually if the officer could expand on the process of trying to make sure that when we discharge someone that they're going back to a home that is fit to be discharged back to. You did mention trying to attempt to deal with mould or poorly heated homes, and that was going to be my question, but the question really is, how could you explain how that works? I think I've got an idea how it might work with a council property, but in terms of a private rented or even an owner-occupier, I'm not sure how that would work. So it would be helpful if I think someone might benefit from whatever process or resources are available, if you could let us know how someone that we think might benefit from that could tap into whatever resources are available.
Okay, so in terms of that, it's not an adult social care initiative in terms of the damp and mould. It's an initiative from property. It's just been socialised with adult social care so that we can, you know, be actively using the tools. It's an online toolkit, is my understanding. It's accessed through some of our Making Every Contact Count stuff that can be found online. There's links to important information online. I think there is, I think that when we met with property, they talked about that there are challenges in terms of the private rented market, and there is an escalation route for individuals to escalate that to the council. But what I can do is socialise the information and the contact that's been shared with us after today's meeting, if that's okay, Councillor Argentia. Then in terms of just understanding the access to a person going home, so if a person's supported by adult social care, they'd primarily go out with short-term intervention team. So they would go out with adult social care support, so a care offer, and they would then be seeing that person within their living environment. The actual assessment of a person's need also takes place prior to, so after they've been discharged. So that's the discharge to assess route, that they're assessed for their Care Act eligibility and their Care Act needs within their home environment. So we would expect that a social worker going into that environment would look at that kind of ergonomic risk assessment of the property in the area and make informed decisions about what that person needs in that environment.
Thank you. Councillor Ayres.
Yeah, my question coincidentally follows on from Councillor Rooney's question about the impact of properties with damp and mould, which you referred to in your presentation, and it comes from a piece of casework, actually. Well, several pieces of casework I've had as a ward member about sheltered housing schemes. And I don't expect a lengthy response today, but how are we linking with our partners in housing and sheltered housing in terms of the structure of some of our, the poor state of some of our supported housing schemes in general, because it's part of the prevention, you know, in order to prevent people getting unwell in the first place, we need to prevent you know, during the winter months, we need to prevent it happening in the first place. I just wondered whether we could look at that, whether you have an immediate response, but I don't expect a full response now.
Oh, and I think it's important to note that the situation with housing and adult social care is much improved. We have active forums now where we're working alongside our housing colleagues. We developed the older person's housing strategy together. So I think there's opportunity and more opportunity to come in that place.
Thank you. I minded to bring this to a close. Councillor Nelson, did you want to quickly come back on something?
I did, because I didn't totally understand the answer about the question about mental health discharge. So maybe it just needs a conversation to understand a bit more. But my concern was really about people being in the right place at the right time and seeing the right people at the right time. And is there an element of chance as to who is in the room, or whether someone with the right kind of flexible thinking is involved in the discharge plan, because there can be make or break elements, I think, to a mental health discharge. And when you see somebody going round a cycle of admission and discharge and admission and discharge and back to crisis house, and there's obviously something that's not quite working out somewhere. And I just wonder what there is in the system really to step outside of the normal processes and actually look at a case-by-case kind of scenario to make sure that the right thing happens, and that therefore pressure on the system is actually reduced, from our point of view, and that patient has the best care possible. So my kind of leading question about, is there recourse to the step down if you're not in the right place?
It's not very fast.
It's
coming back.
It's really about that. I just wanted to unpack why I asked the question a bit, really, for context, because there's a bit in here about mental health discharge, but I think it's a subject that probably does need unpacking at some point.
I'll just come back in there. Interestingly, I have asked for a briefing for the committee on mental health discharge, as the DASCN, just last week, wasn't it? We discussed this. So, Richard, if you've got maybe a short answer for now, and then we'll do it in.
Yeah. So just in terms, so the mental health discharge team support both the Mental Health Trust and STH. So if somebody is in STH, they will still receive support from the mental health discharge team. I think it's as a test for change, which the new activity that we haven't started yet, we've got to work through what that will actually look like. So it's intended to support people stepping back into their own home. It's unclear whether that's going to be primarily just the people in the trust, because that's where we've identified the pressure, or whether that includes the whole pathway.
Thank you. So we have recommendations on page 100 of the pack. The first one is endorse the winter planning framework and actions as set out in this report, including the ICS system-wide priorities and Sheffield-specific mitigations. Number 2, acknowledge protocols for recruitment-related risks via the RCF panel. Number 3, acknowledge the use of discharge grant slippage to fund agency social workers and support warm handover process over winter. And acknowledge the approach to mental health discharge collaboration.
Sorry, Chair. What is the RCF panel, please?
Someone remind me too, please. I know I've read it, and then my brain just forgets it.
So it's the process by which approvals happen for recruitment. So it's a two-stage process, one within the department and then another at senior leadership to approve any recruitment. Recruitment Control Forum, I think.
Thank you. I Googled it and then I forgot to write it down, what it meant. Yeah, it's that I'm being told by legal that that's what it stands for. Recruitment something forum. Yeah, less abbreviations next time. Thank you. Are members happy to approve those recommendations? Thank you. And we move on to item 11, which is on page 133 and is Adult Care and Strategy Development and Performance CQC Process Update.
Thank you, Chair. I would like to say two things to open this report up. The first is that I'll try and avoid acronyms as much as is humanly possible, and I've realised that CQC is littered throughout the report, of course being the Care Quality Commission, so apologies for that. Secondly, you might very well read this report and say it doesn't really say much that's meaningful or particularly interesting, and you'd be absolutely right. And the reason for that is we are at the stage where we've had headline feedback from the Inspectorate. That feedback is confidential, it's not triangulated, it hasn't been set against the statistical evidence that they collated before they got on site, and it hasn't been through any moderation, and indeed the draft report does not yet exist. So we were asked explicitly not to share that feedback internally or publicly because it may be perceived to be an attempt to influence the outcome of the process, which is for the CQC to do. So we are, by means of an update and some stuff that is actually news and interesting, we are now expecting to receive our draft report in the last week of October. Barnsley, who had their inspection the week before us, are expecting to receive theirs next week. So it looks like things are on schedule at the moment. We then have 2 weeks when we receive that report, which will include an indicative score to challenge the report for factual accuracy. So it doesn't mean we can disagree with anything that the inspectors found, but if there is anything that is materially wrong, we have the right to provide evidence to challenge the content. And I do know for a couple of authorities that were in a marginal position, i.e. within a couple of points of one scoring outcome or another, that has made a difference in terms of final moderation. But in many other instances, the factual accuracy process doesn't change the outcome. Once we've responded with points of factual accuracy, and it is my view that we will absolutely prioritise any points that we need to make. Some authorities have taken the approach of qualifying their reports with hundreds of pages worth of submissions around factual accuracy. I don't think that's proportionate or helpful. The CQC will then hold an internal moderation panel. That includes the Deputy Regional Directors, who are the second tier of managers within the Inspectorate, and it includes executive reviewers who are typically directors of adult social care elsewhere in the country or retired DASs. The reports are set alongside one another for consistency to make sure that the judgments demonstrate a level of consistency with the assessment framework. Thereafter, we will receive probably towards the end of December the final report. We receive it 24 hours before it's published, and the first people to be notified will be our communications team, who hopefully will be on the phone nice and quickly to me, so I've got an opportunity to digest it and start the process of briefing accordingly as well. We will be able to brief internally about the draft report, but obviously not confirm what our judgment is at that point. Just to give you an idea of where the 76 reports that have been published thus far have landed, the vast majority, there are 4 key outcomes: inadequate, which would ultimately end up in governmental intervention; requires improvement, good, and outstanding. There are only 4 reports that are not requires improvement or good. There are 2 inadequate authorities, one being Blackpool and the second East Riding of Yorkshire, which was published this morning. There are 2 outstanding authorities, both London boroughs, Camden and Kensington and Chelsea, and all of the rest of the reports are either requires improvement or good. So that also gives you an idea of the scale of work that's yet to be done. There's 152 authorities with social care responsibility. The deadline for the process for all of that work to be concluded is the 31st of March next year. That means there is crudely half of the reports that are yet to be finalised and go through the process. And the bandwidth of inspections has increased significantly as well. So the inspectorate's now doing 3 in parallel across the country to attempt to meet its objectives of having everybody covered by the end of the year. The 5 original pilot sites, which from memory were Birmingham, Lincolnshire, Nottingham, 2 more if anybody wants to volunteer further places, because my memory's gone completely blank. Those 5 sites are now being revisited, so they have had a full inspection included within that deadline of the 31st of March. So by the end of that process, every single council will have a judgment. The CQC is currently out to consultation about what form the next iteration of the inspection process will take. And that will include what level of both scrutiny and support will be available for those authorities who are either inadequate or requires improvement. So a lot of process, a lot of weights and measures data at this particular point in time. We will hopefully be a lot clearer by the end of the month about where we stand. In the meantime, the small handful of us who have had the headline feedback have obviously looked at the evidence that we've got where it sounded like there was further scope for improvement, and we've already started the process of readying the response as well. I expect to bring both the full report back here and to all the usual processes of briefing beforehand, as I'm sure you would expect. And at some point post-report, I think it's highly advisable that we publish a full-blown improvement plan that sets out a point-for-point response about what we're going to do with any aspect of the report where improvement is deemed necessary. Happy to take any questions, Chair.
Councillor Iris.
Yeah, thanks for that, Matt. I'm not quite clear on once all there is a, majorities have, there's been a full-scale inspection of authorities. Is a report produced on common areas of concern? I mean, I'm not quite clear on what happens in terms of producing like a state of social services report.
Yeah, there is exactly that. In fact, it's called the State of Adult Social Care, which can be read a number of different ways, but I think it meant as in status as opposed to look at the state of that. So that's produced on an annual basis. The CQC identify recurring themes. They identify best practice and case studies that they include to help those authorities who need to improve in that space. But a lot of the hard yards and the work that takes place in the ADAS regions. Yorkshire and Humberside, having worked most of my career in the West Midlands, Yorkshire and Humberside's got an excellent branch offer in terms of improvement support. It's a very collegiate region. All authorities proactively support one another, share evidence, share best practice. There's multiple thematic networks that our staff are represented in. They take as much out of that as they contribute. And we're already working with organisations like Bradford, who had a very strong inspection outcome, and we're learning from them about their approach to positive risk-taking, strengths-based assessment, etc. So the CQC's publication is helpful, but the real engine room for the work sits at a regional level, and it's local authorities working with local authorities.
Okay, are there any more questions? So we have some recommendation on page 134. So there are 3: note the performance and delivery of the on-site CQC visit, including staff participation and experience. Number 2, notes the preparation of the CQC assessment, which will conclude before the end of 2025, and notes the next stage of the CQC assessment process and potential impact on the final outcome. Are members happy to approve those recommendations? Great, thank you. We go on to item 12, which is on page 155 of the pack. And Liam and Catherine are presenting this item.
Hi, good morning. My name's Catherine Bunting. I'm the Director of Quality Strategy and Partnerships for Adult Care and Wellbeing.
Hi everyone, I'm Liam Duggan. I'm Assistant Director for Care Governance and Financial Inclusion.
So I just want to take about 47 seconds of time, hopefully to set some of the wider context for this report. The report describes a programme of transformation and improvement in adult care and wellbeing to deliver on our strategic vision and as part of the Council's Future Sheffield programme. Future Sheffield's a 3 to 5 year programme of improvement and change for the Council to become an organisation that is modern and can deliver on our Council plan, improving the lives and outcomes of people in the city. There's 11 programmes in Future Sheffield under 4 key themes: empowering communities and customer experience, improving service delivery, strategic capabilities and enabling services, and thank you, I've got a sign, and commissioning, procurement and contract management. This proposal is adult social care's sort of required element of the improving service delivery layer of that Future Sheffield programme, and it will also help us to both inform and influence all the other interdependent programmes in Future Sheffield in becoming that organisation. And then finally, I just wanted to say that as we develop this programme, of course, we'll be incorporating that feedback from the CQC and measuring and monitoring our impact through our performance and engagement with people in the city.
Thank you. So, this report proposes the initiation of a major change programme for adult care and wellbeing as part of the Council's Sheffield Future programme, as Catherine just said, and the commissioning of a strategic partner to support its delivery. So I'll run through very briefly before we move to questions. The start point for this conversation is our vision for adult social care, Living the Life You Want to Live, which was co-produced in 2022, and the significant improvements we've been making to adult social care services since 2022. But the ongoing and unrelenting challenges nationally faced by adult social care in relation to increase in demand and complexity put increasing amounts of pressure on adult social care on our budgets and makes the delivery of our vision within available resources ever more challenging. So in February 25 this year, the Council procured a diagnostic analysis of adult care and wellbeing with the support of Newton, an external provider, to understand demand and to identify the drivers and to recommend priority areas for transformation to benefit residents and support the delivery of our strategy. More than 160 people were reviewed in workshops undertaken by our frontline workers to understand where ideal outcomes had not been achieved and to get behind the reasons for that. And what the diagnostic has provided us with as a result is evidence of how systematic changes in approach, with a continued focus on promoting long-term independent outcomes through prevention, person-centred demand management, could have a transformational impact on a high number of people's independence and outcomes. And it's this evidence that's been used to model a future programme of transformation change that we're bringing forward today. The programme is based in 2 parts: whole life disability pathway for working age adults and proactive and preventative support for older adults. There are 7 work streams which are set out in section 3.4, but perhaps even more importantly, there are a series of cross-cutting enablers which sit across each of those work streams and get into some of the key areas that are needed across all teams and ways of working to achieve a step change in our improvement journey. Delivering those opportunities would improve the lives of around 4,500 residents a year, and there's some significant and really meaningful impacts on people across the full range of our adult social care services that are set out in section 3.7, some really exciting and tangible benefits that would support people. But there are also other direct benefits that we can that we can bring forward as well, linked to these proposals. We are proposing that the delivery of a transformation programme at this pace and scale will require the support of a strategic partner. And this is because the proposals that we're bringing forward are dependent on rapid and fundamental changes to a number of diverse areas and challenging areas of change, most notably areas like culture, ways of working, practice, but also technology. And these are areas where the Council and Adult Social Care have struggled to make significant improvements in recent times. The Council's change capacity is already deployed on the Future Sheffield programme, and so there is an aspect of this where we're going to need support to external support and capacity to support this level of change. But to get into those areas described, we'll also need access to national best practice, specialist knowledge around systems design and other aspects of change that will maximise short-term impact, but also deliver a legacy of lasting change across the Directorate. We are proposing a programme that's going to last, a partnership that we're expecting to last up to 2 years, potentially 3, where much of that involvement will be around upskilling council frontline workers, supporting the development of our own systems and processes, monitoring processes, reporting, use of data and forecasting. And so critical to the success of this programme will be the engagement of our workforce and of the council with this partnership. The proposal covers significant financial implications. So the council's gross budget for adult social care is £367 million. Based on this diagnostic exercise and the interventions that we're proposing, it's estimated that we will deliver a targeted value of £24.7 million worth of annualised recurrent savings by 29/30, which is a £70 million cumulative figure by that point, and a stretch target of close to £30 million cumulative recurrent savings each year by 29/30. That's not including inflation and growth. Delivered collaboratively with an experienced strategic partner, we're proposing a one-off cost of up to £10.1 million that would be fully contingent on the delivery of these better outcomes and a contractual guarantee of 1.5 times that fee cost in annualised financial benefits. I'll take questions.
Councillor Gilligan-Coulter.
Thank you. Thank you. It sounds a very exciting and interesting development. I just want to clarify something firstly. You're working with the partners, Newton, or whatever you said they're called, for 2 years, is that right? Or is it for longer than that? I mean, I just want to know what happens after they step away. Will the programme continue? And so it's building up capacity, so it will be an ongoing thing. Is that correct?
Yeah, that's helpful. So, so Newton were commissioned to support with the diagnostic. The diagnostic was the analysis exercise that was undertaken over 4 months earlier this year. And it's from that diagnostic exercise that we are setting out the programme and the opportunities for improvements. And what we're seeking committee to do today is to approve the commissioning of a strategic partner to undertake the next part of that, which will be support of the transformation programme. The council's arrangements mean that the decision is for committee to take around the commissioning of a strategic partner, the budget and timescales for that, and then there will be a subsequent process around a procurement strategy and officer decision making around the appointment of a contractor. But absolutely fundamentally, from day one, what we will be looking for from this strategic partner will be working alongside council officers to initially set up the monitoring systems, the dashboards, to review the data, to set the new baseline and targets, to work to identify colleagues from across the service who will work alongside the provider to be upskilled. A huge part of this is workforce development, investment, so that right from day one, this is a partnership where our workers are being upskilled to deliver change in a new way with access to sort of national best practice. We expect that the intensive work will take 18 months to 2 years, following which there will be a retraction by that strategic partner. But almost from day one, we're expecting that council teams will be leading this change. A good example of that is around the new ways of working will include different uses of data, a much more data-based analysis to understand where interventions count and what value interventions make, so that we can make better resource allocation decisions. And getting into that data, providing those dashboards, will be a really early piece of work where our business information team will be working alongside the partner to redesign our ways of working, so that effectively will create a platform in the future for us to incorporate new and different areas of improvement, and build on those improvements, build on the infrastructure that we'll have to sort of to build out and extend the programme following that initial 2 years.
Councillor Aris.
Yeah, well, we're talking about a significant investment here, you know, to deliver a targeted value of £24.7 million. So, I mean, we all understand the backdrop to this, you know, significant underfunding from central government of social care, which many of us have talked about for the past 20 years, I think. Some of us, some of us have been here a long, long time. That said, it is a significant investment, and I want to be reassured that we're delivering something, a transformational change programme that will actually deliver the targeted savings that we want, that we need, well, not that we want, but we need in order to deliver the services to the people that we serve in this city. So what is different about this transformational programme from others that perhaps sometimes haven't delivered in-year savings, that will give us reassurance that the savings are achieved for you know, the return on the investment is achieved, and that over the period that as elected members we will be kept up to abreast of you know, the targets, you know, deliver against the targets. The other question I have is clarification about the process from here. Presumably what we agree today, because so much of this investment, if you can just clarify, the investment will not totally come from the directorate budget totally. There is corporate investment, so it will have to go through, is it finance subcommittee for final sign-off because of the corporate investment that's required. I just want some clarification on those points. Thank you.
Chair. Thank you. Yeah, so this is very different from what we've done before. I think the start point for this being different is the diagnostic that we've undertaken, that 4 months of work that's been undertaken with our frontline workers, working through individual scenarios to understand how those people were supported, what their outcomes were, whether those staff felt that better could have been done, and why we didn't achieve what we might have liked to achieve in an ideal environment with those people. And I think what that's given us is a really granular view of the opportunities for improvement, which comes through in the financial numbers, and the changes that need to be made to make those differences. Now, the changes that need to be made to support those is getting us into the areas where what's different, I think, what's different from what we've done before, perhaps what the local authorities have done, which is to get into those really challenging areas that are more difficult to deliver. Things like the getting capacity. We hear that a lot. Increasing demand, less time to get through the work, challenges delivering reviews, seeing the right people at the right time, providing the right interventions at the right time. How do we free people up to spend more time working with vulnerable people and less time doing other aspects of the job that people feel tied up with, like writing things or attending meetings or what have you. How do we ensure that people understand their responsibilities around risk, that risk isn't sitting with the individual, the risk is shared across the council, and that frontline workers are feeling empowered to make the right decisions in the interests of the person. How do we ensure that the people who are being referred to us for support, for reablement, are the right people, the people who are going to best benefit from that reablement potential, and that the interventions that we're making are the right ones at the right time. It's those sorts of things that this programme is going to be getting us into in a way that we've not been able to do before. In terms of the way that the programme is wrapped up, what we're looking at here is not a kind of an annual look at savings as we have done for the last few years. We've got a fully costed medium-term plan that will take us through until 29-30. So we're not promising everything next year, but we do have a really granular plan for how this will be delivered over the medium term, and it's a holistic plan as well that covers all aspects of adult social care. The other thing around how will we be kept abreast of where we're going, I think that's a really significant departure as well. I spoke in the last answer about how these proposals are really firmly rooted in evidence. One of the first things that we will be doing is overhauling the provision of information to our operational managers, senior managers, and to you in committee, so that you'll be able to see really clearly where our interventions are making an impact and where they're not, where we might need to put a little bit more emphasis to make things happen, or where we might be overachieving in certain areas that will kind of help us with others. So the clarity of our and visibility of our data is going to be a significant part of this, both in terms of the operational management, but also in the opportunities for kind of governing this through this committee and through other structures. Where will the funding come from? Well, this is, we're looking at really significant financial implications, financial impacts over the course of the next few years, and the cost of the programme would be funded by the the savings that are made. So the costs are fully contingent on those savings, and so we will ensure that we're able to fund those costs in the first part from the savings that are made. This decision is of course part of the Future Sheffield programme and part of the wider council's ambition, and the Strategy and Resources Committee last month did set out how it was its expectation that adults would need a strategic partner for the delivery of this programme, but the decision to commission the strategic partner is with this committee. Yes, so there's a two-part process for all commissioning in the council. This first part is for the committee to make a decision about the need to commission an external provider and to set a budget limit on that and maximum time frame. Should this decision be made today, then it will be there will be a piece of work to undertake the development of a procurement strategy, a specification, and to work with our colleagues in finance and commercial services to determine the best route to market for the appointment of a strategic partner, and the contracting decision will be an officer decision.
So I have hands up from a request from Councillor Rooney, Councillor Wright, Councillor McLean, Councillor Milson, and if there is time, Councillor Gilligan-Cuba wants to come back in. Councillor Rooney.
Thank you, Chair. Just to add my, I'm not doubting Liam's integrity when he gave that very, very in-depth reply to Councillor Aries' question, but I do share Councillor Aries' scepticism about this being able to deliver the sorts of money that we're talking about, because I remember very similar words being said about the Better Care Fund year after year, which didn't deliver anything near the sorts of savings that it was supposed to. So that's the first, I'm not sure whether that's a question or a statement. In terms of the upskilling, I mean, I know from personal experience, family experience, that in the private sector, time after time, employees in the private care sector are asked to do more under the guise of upskilling and not receiving the commiserate recompense for these new skills. So have you any idea what this might mean in terms of the contracts that we have with our workforce, or are there any implications for having to renegotiate either pay rates or job descriptions as a part of this? The other question is, where do our partners, such as health, the third sector and the private sector, fit into this major, it's a major reconstruction of the way that we do things? And some of our partners are integral to what we do, so I'm trying to work out where they fit into this. And the final one was about, I think you said that this programme doesn't take into account increased costs or increased demand, and I realise that some of that is a bit of guesswork from year to year, but one thing is absolutely certain, that is neither of those are going to go down.
Matt, do you want to come in first, and then I'll give...
Yeah, thanks, Councillor Rooney. So, firstly, I think as officers we have to accept scepticism on the part of the committee. The consistent delivery of savings has not been there, is a big factor in where we are financially this year. The larger the numbers, the greater the concern about how real it all is. So I think if this is approved, it will be the core of our work for the next 3 years in terms of change, and that means it needs a proper board overseeing it, and it needs regular oversight and scrutiny from this committee, which would include clear phasing about when the cash comes, how it impacts on the bottom line, how the changing nature of demand that we experience as a service is reflected. And I think we have to be fully transparent and really detailed about the way we account for that and allow you to challenge. And I wouldn't take anybody's complete wholehearted commitment to this at this particular point. I think there is significant risk in landing a programme of this size, but I think we need to think about risk on both sides of the coin, because the reality is we move from year to year with significant recurrent budget pressures, largely due to demand. It's not money that disappears, it goes into care, as members of this committee have acknowledged in the past. But we cannot continue to keep spending at the level that we currently are at a time when we know demand is going up. So the only way we can address that long term is by changing when we intervene and how we intervene. And there's a lot of cases that come through this committee where, unfortunately, people interact with the council as a fourth emergency service. It's too late. They've already had the falls, the living environment's not fit for purpose, the opportunity to get somebody back on their feet supported, or to maximise their independence if they're a younger adult, is missed. And then we end up intervening with the most costliest services for the largest chunk of those people's lives. So our choice ultimately here is whether we go down a route of cutting money out of services we currently provide, or we try and change the way that we offer them. And what we've seen elsewhere in the country is that where councils go down the route of cuts, and we've already done some of that anyway here, when you do that, the need for the care doesn't go away. All we will do is push today's problem into tomorrow and then end up intervening tomorrow at a higher level when that person is negatively impacted by the amount of time it's taken us to get there. So I completely agree with the questions that have been raised by both Councillor Rooney and Councillor Ayres. I think the onus is on us to prove that this will deliver what's written on the tin. I don't think it will be linear. I think this is a complicated programme of change management that's got risks, and we need to be open about those risks, what we're doing about them, and whether we're moving where we need to be. But ultimately, with the funding that we receive and the legal framework that we operate to, we either limp from year to year doing the best we can to try and mitigate what inevitably will be a series of overspends, or we try and change it. And that is what is at the crux of this. And it's very much linked to Future Sheffield. This is the adult social care bit of Future Sheffield. And I think we've got a lot of work to do on communication with staff, because a lot of them will feel like this is a third party landing from Mars in terms of the way they go about their work. I think we have to come at this from a point of strength, because our staff do really valuable work in a tough environment. It's about working with, not doing to. And to answer the questions about partners that was raised, the ICB are already doing a parallel piece of work that's linked to this. There is more work to do to get around the table and agree where the points of crossover sit, but there are points of crossover. And I think we have got evidence of some of the transformation work that's been done being really effective, like the home care work, where we took a radically different approach to market, a radically different approach with the organisations that we work with. We put more trust and confidence with the providers and gave them more flexibility about the way that they did the job that we asked them to do. And the results of that are we don't have people waiting for care. We don't have the capacity issues in this city that others do. We do have better quality terms and conditions for the staff who are in those jobs. And now we're working on getting the career pathway sorted so those dom care staff can get the training and development that they need to progress through and have a proper career pathway, which is something that this country has singularly failed to do with frontline care staff for all of the time that I've worked in social care. So I don't think we can get you to a point of complete comfort today, but that is what we're trying to do and the reason why we're trying to do it.
Liam, do you want to add anything? Catherine?
Can I just add something about the providers? And you mentioned, so absolutely, we're only going to achieve our vision and improvement in outcomes for people in the city if we work in a collaborative way, and that is what we try to do. And we're benefiting now from much improved relationships with providers. And what I know that they would value is that same medium-term planning, that medium-term understanding about finances and demand, so that they have the headroom, the space to think about how they can adapt and what the future might look like for them, as well as sort of building on what Matt said in some of our more recent provider forums. They have a lot of expertise about what makes a difference to people, and they're embedded in our communities. And by getting them involved in this programme and in that governance process, we have a better chance of using that collective experience and knowledge to deliver that shift change for people in Sheffield.
Thank you. I'm going to take Councillor Wright, Councillor McLean together, and then Councillor Root. Okay. So I'm going to take Councillor Wright, Councillor McLean together, and then I'll come back to Councillor Milsom, and then we'll see if we've got time for more.
Thank you, Chair, and thank you for the report and your explanation of it, Liam. Thank you. So I've got a couple of linked questions. It's always a worry when we chase efficiencies, vital work, but it's always a concern that that might result in a poorer service for people receiving these this vital support. What measures will you be using? You've talked about data and about improving information flow to managers and to people who are operating and running this transformation. Do we know yet what measures of success you'll be working on above and beyond financial improvements, and the metrics that you're using? Can we be sure, because we need those to be relevant and accurate, so that we can be sure that services are improving for, or at least maintained at their current quality during this process. And linked to that, I was very reassured to hear that frontline staff were involved in the diagnostic. Can we be, will it be the case that frontline staff and service users will have a strong voice in those measures? So as well as the quantitative data and the numbers and stuff, that we'll get some qualitative data asking them about their experience during that process as well.
Can I ask Councillor McLean to ask a question?
Thank you, and thank you for the report. The potential to sort of achieve this level of savings whilst also getting better outcomes for people is obviously exciting, but I sort of echo, there's a few points of clarity but as we move ahead, and just got a few questions. We mentioned, I think when we responded to Councillor Aris, that this is the sort of programme that we haven't achieved before. We've not done something like this. And obviously we've got this forecast overspend from Q1 of 31.3 million. And I guess my question is, sort of in light of everything, is what we're saying is that, would it be difficult without external help for us to sort of achieve this level of savings in that time frame, without that extra help? Do we have the capacity to do this ourselves, or is that not an option? And I guess, have other adult services across the country, have they taken this approach as well? Just be interesting to hear, just for context. Thank you.
Thank you. Okay, so the first question from Councillor Wright was about a worry that efficiencies would result in a poorer service. So, what we're looking at here is not making reductions or making sacrifices around the quality of our services. What we're looking at is how we might deliver better outcomes for people. Where we've failed to deliver the best possible outcome for people, what was the reason behind that, and how could we do better in future? So it's fundamentally about driving quality and achieving a step change in personal outcomes in order to, at the same time, reduce demand for formal social care services. So the diagnostic identified a range of missed opportunities, really, where our staff were looking back and thinking, if that had been different, we could have done this. And that's what's from that we've identified what might be possible. And the what might be possible is set out in section 3.7. So there's improving the lives of around 4,500 residents a year. That's broken down into a kind of a a look at, well, what would that look like in transitions? How many people coming through our transition service? How are we not optimising the support for people through transitions? What would our target be? How many people would that impact? And so when we look at delivery of this programme, we won't be, yes, we'll be focused on the financials, that's absolutely critical, but before the financials, and in order to get to the financials, we'll be needing to understand against each of those bullets there, how well are we delivering on those outcomes? Because you can look at each of those outcomes, and each of those outcomes will translate into some sort of financial benefit. So that, you know, the dashboards that we provide, that will be the scope. It will be individual outcomes and how well we're delivering against those. The frontline staff, service user involvement is obviously absolutely critical. That started with the diagnostic, and we will with 160 people's experiences, and that's how the thing started. But co-production will be a fundamental part of this. So we're talking about potentially having a metric for each work stream about how much someone has been involved and whether they were happy with their own planned care package and what happened in relation to that. But of course we'll also be looking at our existing structures, our co-production for and the regular meetings that we have with service users, people with lived experience, and they will be absolutely involved in the development of the proposals and overseeing the direction that we're taking. So absolutely co-production will be at the heart of this.
Sorry, I just wanted to add to that as well, that we've all come into this job to make a positive impact to people's lives, and as well as our own performance framework and the I statements that we use and our partnership with Healthwatch and the surveys that we do with people that either come through adult social care or use our commission provision really help us to test that, as well as that regulatory framework, and that's how we measure the impact that we're having, and all of that will be framing this programme so that we're absolutely driven on making sure that we're delivering the quality of services and the outcomes that we want for people in Sheffield.
There was also a question about qualitative data. So, you know, we will be quantitatively measuring the achievement of those outcomes as I've described, but, you know, we've also been talking to members of the committee about the importance of having continuing with our automated surveys, the I statement questionnaire. You know, there will be lots of qualitative information that will be triangulating to make sure that the improvements are being made in the right way, and it's not just people's outcomes that are improving, it's also their experience of their journey through social care as well. Councillor McLean, would it be difficult without external help? I think, you know, really this is a hugely ambitious programme. It's a really challenging and ambitious timeline and pace, but it's also ambitious in its scale, and it's the scale that will be achieved by making those changes that we've spoken about that are more difficult to make. And we've tried to make them, and we are making changes. You know, things are improving in adults all the time. I guess the question is, are we making changes at the pace that the council needs them to ensure that the service remains sustainable? And I think that the answer to that is probably not. We need a helping hand. We can get a real injection of expertise, best practice, systems design, use of data, data analytics, forecasting, you know, that will rapidly see us take a step forward in a way that, you know, would by ourselves take us a really long time. The investment is significant. It's one-off. The changes, if we embrace this and wrap ourselves around this delivery partner, will be forever, and that's the key part of this. Did I answer? Is the number there?
Thank you for your answer. It was just a question about whether other local authorities have taken a similar approach at the moment.
She had asked that question already. You wait your turn.
So yes, lots of all local authorities are wrestling with these issues, and some have taken this approach, some haven't. We've spoken to a number of local authorities in the development of these proposals to try to ensure that we're not making any mistakes that others have perhaps made, and that we can have confidence in the way that we're going forward. And yeah, we've got a number of local authorities that we have spoken to, and that we could share with you. You know, if members of this committee equally could talk to other local authorities across the country who have been through a similar experience, to talk to your counterparts and check out with them how they found things, and that could be a helpful way forward as well.
Yeah, that sounds really positive.
Matt wants to come in.
Just to beef that response up a bit, I can assure the committee we will not work with a transformation partner that has not delivered multi-million pounds transformation programmes, and we will require formal references for any of the bidders to prove that they've done the things that they've said they would and that it's been sustained. It can't just be the case that you spend this money on consultancy, they disappear, and then all the benefits disappear out the door. So we will have to very assertively focus on that through the procurement process.
Thank you. I'm just conscious of time. So Councillor Milsom has indicated, so I'll take her question, and then I've got Councillor Kubo, Councillor Eris and Councillor Rooney, who quickly can come back in. So Councillor Milsom, do you want to ask your question?
Thank you. I'm just checking we end at 12:30, don't we? Yeah, okay, thank you. So I'd just like to check up a little bit more about the how the money side of it works. You said, Liam, that the fee that we would pay is contingent on savings being delivered. So I think I understand that if a certain threshold of savings is not delivered under the purview of whichever partner is commissioned, then our liability to pay that full fee that's taken into consideration. But to put the boot on the other foot, what is our risk or liability if, say, that delivery partner that we've chosen makes certain recommendations that are not palatable to us, and we do not collaborate with implementing those? Are we putting ourselves in a greater risk? And how can that be guaranteed against that scenario happening? So how much groundwork in terms of what's going to be required of us is there before we actually agree to pay that fee? Or we're not trapping ourselves into having to make unpalatable steps. And I just wanted to comment really on a rather nice paragraph in the sort of the scope of change that is set out in the paper, expanding our presence and impact into the community using new preventative data analytics. Very excited about that. To reduce by up to 10% the number of older residents requiring new home care support through early and focused interventions. I just really wanted to comment that I see that as a very exciting, a kind of broad horizon kind of transformation. And as with similar conversations that happen on with the NHS, it's about seizing that opportunity to release resources into the more preventative sphere, and I think not thinking of that area as one that needs to be owned by the council, and it's not statutory stuff that we provide, and so there's a huge scope to work with other partners, and partners that we might not expect to work with, and there's myriad people and little groups going on very informally out there in the real world that we don't have much contact with, but who are making a massive difference to how many people need our services. And I think that there could be scope there to invest a little bit in tapping into that and seeing how more collaboration could work better. I just wondered if that's kind of in scope. And I mean, is there scope for investment during this savings transformation? Is there actually, will there still be an open door to investing in certain things to deliver longer term savings than what's in scope with the 2 years?
Thank you. So, yes, so how does the money side work? Yes, we would be we would be going to procurement on the basis of the fee being contingent on delivery, and so we would be looking for at least 1.5 times a return in annualised savings compared with the cost of the investment. But we would be seeking a contractual target that would be well in excess of that. And as Matt described, we would be looking at track record and how providers have fared in delivering those levels of savings. What is our own risk and liability if the recommendations are not palatable? I think that this kind of goes to our procurement, and what we are completely wedded to is the delivery of savings in the right way, which is consistent with our vision and strategy from 2022, which is about person-centred demand management and greater independence. And we wouldn't be partnering with a provider that would take us away from those core principles. So, you know, we're looking to build on the learning from the diagnostic and the direction that takes us, and that's what we'll be looking to deliver. The other part of this is that there are a lot of great ideas existing within adults, and we go out there and we talk to people. There's, you know, if we ask the right questions, people are falling over themselves with ideas about how we can improve, what we can do, where the opportunities are, and so for a provider to be successful in this environment, they will need to engage with our workforce and to release those opportunities too. It's not going to work to come and impose a different way of working or to take us in a different direction. So the provider will need to understand and release the potential that exists within our teams as well. I share your excitement about the potential that this unlocks. I think it's probably a question for somebody else about whether there will be money for investment in different areas. But what I can say is that the development of the tools that will be necessary to steer the programme will be a fantastic step forward for us in understanding how we deploy resources and the financial impacts that can have. And I think that will make much more compelling cases within the council for how we're to deliver a sustainable adult social care service and shift that investment from long-term high needs care upstream. So I think that those conversations following this change will be a lot easier to be had, and will be the business cases will be a lot clearer.
Thank you. I'm going to ask the three people who already asked questions to ask their very quick question together, and then we'll respond to that. So I've got Councillor Gilligan, Kubo, Councillor Aris and Councillor Rooney, and then we'll answer those all together.
Thank you. I'm not sure mine is a question now because I think it's been answered. So as adult health and social care, we are to aim to provide, to enable our adults in the city to live the best life they can with whatever physical or mental difficulties they're facing. And I think what Ruth was saying is, the paper says that the demand will be increasing, but what we also need to look at is how we can stop the demand increasing, isn't it? And I think Ruth was mentioning it. There are partners, there's our NHS frontline staff, there's our hospitals that can stop people coming to need our services in the first place. So I think all I want to say is I hope we can work with these sectors and the voluntary sector to stop the demand increasing. So I don't really think it's a question anymore because I think you've answered.
Councillor Aris.
Mine was a comment. Are you taking comments as well?
Quick one.
Yeah, quick comment. Yes, I'm reassured by the officers' responses. But I think alongside this, Chair, I do think that we should use whatever channels we can to make our representation to the Casey Commission, given that we are here proposing to take a decision for procurement to invest because of the yield that brings back to not just the department, but to the city and the region as a whole in terms of the local economy. And I do think we do need to make representation to the Casey Commission in that respect. Thank you, Chair.
I'll take Councillor Rooney and then I'll bring officers back in.
Thank you very much, Chair. Apologies for my impatience, but the reason is that the Director didn't actually answer my questions. I asked a question about the possible impact on the Council's workforce about these changes, and he answered a question on the impact on the private sector. I didn't ask that question. I also expressed scepticism based on experience that Steve and I have had with the Better Care Fund. And in no way did I question the need for this programme at all, and you gave an answer at length justifying this programme. I never doubted it for 1 minute. What could be really radical solution would be that some government or other actually funded the care system properly. That would be really radical, wouldn't it? And the third part that you didn't touch on was, I think, is the fact that it doesn't, if I heard the officer correctly, it doesn't include any assumptions on increase in demand or cost. Because if they follow the pattern that they have in recent years, they could quite easily blow this programme out the water.
Thanks, Councillor Rooney.
Apologies. So, the impact on council staff.
Sorry to cut across you, Liam. I think the comments were directed at me, so I'll respond if I can do. There is no known impact on terms and conditions of council staff at this juncture. There is no anticipated direct impact on terms and conditions of council staff through this transformation programme. In terms of your comments about long-term funding for adult social care, couldn't agree more. And in terms of the question about the Casey Commission are coming to Sheffield in November. We will be explicitly raising the points that you've raised, Councillor Ayres. I will also be going down to London to give evidence to the Casey Commission as part of the work that's building up, so I'll make sure that the pressures and the demand that the city is experiencing is reflected in the work of that commission. And in terms of the Better Care Fund, the Better Care Fund was an investment pot to improve the urgent care system. I'm not aware that the Better Care Fund has delivered significant efficiency savings at scale anywhere in the country. What it's done is funded the increased demand that's gone through the hospital system year by year and enabled councils to take a different approach to the way that they manage that demand. So sorry if those responses weren't specifically clear. I just want to comment on the topic of Councillor Milson's comment about what is palatable or not, because I think that's really important. So let's be clear here. We are governed by two primary statutory frameworks, the Care Act and the Mental Health Act. Nothing that is recommended to us can breach the stipulation of those two pieces of legislation. We will not be doing anything that breaches our statutory framework. We will not be doing anything that the regulator would frown upon or criticise us for. We are going to have to accept a level of challenge about our thinking. That's what transformational change is. And I think that will stretch and challenge all of us in different ways at different parts of the organisation. But I think we have to have the humility to learn as well as build on a lot of the really positive things that do work already. And the goodwill of staff is absolutely critical in making this happen. Thank you.
Yeah.
There's a final question there from Councillor Rooney about demand assumptions, so if I could just clarify that. The financial benefits that are recorded in the report of £24.7 million to £28.9 million recurring annualised savings by 28-29, it's those figures that don't include growth in them. So, of course, as our finance colleagues model our pressures into the medium term, they will be building growth assumptions on. I only reference that because the figures that I've described, whilst they relate to 28-29, are given in today's terms. So effectively those savings will be inflated quite significantly by the time we get to 28-29. I was just trying to describe the fact that the 28-29 savings don't include that growth. So in real terms, when we get there, the numbers will be bigger.
Thank you. I'm going to draw this to a close and I'm going to read the recommendations. Before I do that, can I make a suggestion? If we agree on the recommendations, and we'll see whether we agree or not, can I suggest that we, when the time is right, so after we've decided who the partners are, if the committee agrees on the recommendation, can I suggest that we create a members working group to agree on the evidence that we want to see and the key performance indicators that we want to see, so that then we can be part of the kind of what we expect to see and how regular we want. I am sure that there will be something in the future Sheffield as a whole. I'm hoping that they've already thought about that. So it might fit in with some of the stuff that future Sheffield are already planning to do. But can I take the recommendations, and then if we accept the recommendations, are people happy about having a working group? I'm not calling it a task and finish group, I'm calling it a working group so that we can decide how long we want it to last and etc. Is that okay? So the recommendations are on page 156. So we are asked to approve the initiation of a medium-term transformation programme for adult care and well-being as part of the wider Future Sheffield programme in order to drive an improvement in outcomes and financial sustainability. Number 2, approve the commissioning of a delivery partner up to a maximum value of 10.1 million for up to 3 years to support the delivery of this programme. Notes the expected financial benefits of between 24.7 million and 29.8 million of annualised recurrent saving by 2029-30, which will be aligned with the Council medium-term financial plan. Number 4, notes the internal resources will be required to deliver the transformation programme. Are members happy to support those recommendations? Is that unanimous? Brilliant. So am I taking that we will get together and think of whether it's, talk to Future Sheffield programme as well and see, have a members working group? Brilliant. Thank you very much. Thank you so much to the officers. And this brings us to the end of our meeting. I just want to remind you that our next meeting is on Wednesday, the 10th of December at 10 a.m. Also, there is a briefing today at 12:45 for the whole committee. It's in person in committee room 1 and it focuses on finance. It should be in your diaries. Thank you very much.